budget I'm presenting today supports these goals and reflects...
Ever since his controversial pick as Health and Human Services Secretary, Robert F. Kennedy Jr. has come under fire for his incoherent responses to questions on vaccines.
If you had a child today, would you vaccinate that child for measles?
For measles, what I would say is my opinions about vaccines are irrelevant.
But that's kind of your jurisdiction because CDC does give advice.
July 9th, and the CDC, the Centers for Disease Control and Prevention, has reported that measles cases have hit a 33-year record amid declining children's vaccination rates. It puts the onus back on those in authority who leave doubt in the public's mind about the benefits of vaccination.
Measles is a highly contagious respiratory virus that has plagued humans for an eternity. But with the advent in 1964 of very effective vaccines, we saw a decline across the world and in particular in the United States, to the point that by the year 2000, we declared measles eliminated.
Most measles cases this year have occurred in a Texas Mennonite community with low vaccination rates, although there have been notable outbreaks in New Mexico, Kansas, and Kentucky, amongst other states. The measles ranks as one of the most contagious viruses, and the fact that there haven't been more cases this year is testament to the herd immunity that's acquired over decades from high vaccination rates among children and adults.
Because vaccines have been so effective, they've actually become victims of their own success, meaning young parents, for example, don't see the diseases killing children.
The problem is that inoculation rates need to stay above 95% or so to limit the virus's spread and protect those who can't get vaccinated, such as infants or the immunocompromised. In other words, refusing to be inoculated for measles can cause harm to others.
It really is made more difficult when you don't have a population that believes in evidence-based science and is racked with concerns about conspiracy.
Today, most parents still have their children vaccinated, and 83% of Americans say the benefits of the MMR vaccine, that's measles, mumps, and rubella, outweigh the potential risks. It is 97% effective after all, but trust in vaccines could slip if those in authority continue making confusing claims that on the one hand encourage you to get vaccinated, and on the other, sow the seeds of doubt as to whether it's the right thing to do.
We should have transparency, we should have informed choice, but if people don't want it, the government shouldn't force them to do it. There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information and encourage them to vaccinate.
The measles vaccine is made from a weakened virus, and much like other vaccines, it can cause a rash and low-grade fever for a few days. But it doesn't cause life-threatening ailments in people who aren't immunocompromised. And yet, since his appointment as Health and Human Services Secretary, Mr. Kennedy has repeatedly downplayed the current measles outbreak, for which 3 people have died, 2 of them children.
The Secretary has touted unscientific and unproven cures like cod liver oil for measles.
Public skepticism of public health officials accelerated during the COVID-19 pandemic because of the dishonesty of those guiding policy, such as Anthony Fauci and others. To regain that trust, the public needs clear guidance, not people sitting on the fence with wishy-washy answers and spurious claims.
We need to be strong advocates for vaccines. They really have changed human health and they benefit people greatly.
Fox News reports that in the 2023-24 school year, a little under 93% of kindergartners had had their MMR vaccines in the US. And with the CDC reporting a 3-decade high for the spread of measles across the country right now, 1,300 cases so far, there isn't time to lose.
I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice
Right.
from me.